Hello and welcome to another episode of Let's Talk Health. Today's session will be on erectile dysfunction, and to discuss this, we have with us a consultant urologist and an andrologist, Dr. Bhanateja Reddy, Citizens Hospital, Shevingapalli, Hyderabad. Good evening, Doctor.
Good evening.
So before we start on this question, I would request you to give our viewers a glimpse on your expertise.
Hi everyone, I am Dr. Bhanateja Reddy, consultant urologist and microsurgical andrologist. I am trained into andrology procedures from Mayo Clinic, United States. I do specialized and advanced andrology and male infertility procedures, along with the routine urology procedures.
So coming to the first question, Doctor, what is erectile dysfunction and how common or prevalent is it?
Erectile dysfunction is a common condition where a man has the inability to maintain or obtain an erection hard enough to perform sex or have a sexual intercourse. So this is usually seen in aging males more commonly than the young males. Young males do also have it, but that's mostly psychological. Most of them do well with just proper counseling. And as we age, so 50% of them above the age of 50 years, as well as 60% above the age of 60 years tend to develop this condition. So this is mostly due to physical causes.
So my next question would be, sir, which doctor or specialty should a person with erectile dysfunction consult?
So erectile dysfunction is mainly related to the male sexual function. So andrologist or a urologist is the pertinent doctor for that. So everyone who is suffering from this condition should definitely meet a urologist or an andrologist, definitely.
So coming to the next question, doctor, can erectile dysfunction cause infertility?
Yes, erectile dysfunction can cause infertility. Because of having erectile dysfunction, the couple might be in a lot of stress. They might be having some issues with self-confidence and relationship problems that can lead to infertility. So yes, definitely erectile dysfunction can cause infertility.
So what are the symptoms of erectile dysfunction?
So erectile dysfunction is mainly a man who cannot attain erection or who cannot maintain erection. These are the two main important things with erectile dysfunction. There are also few people who might have loss of self-confidence because of this condition. So these are which we commonly see in these men.
So doctor, what are the common causes of erectile dysfunction?
So there are many causes related to erectile dysfunctions. So the most common ones are its association with diabetes, obesity, hypertension, any heart diseases, people who are suffering with any spinal or spinal injuries or accidents related to their pelvic bone or in the area of pelvis, causing damage to these nerves can cause erectile dysfunction. And few of them who are suffering from neurological conditions like Parkinson's disease or multiple sclerosis can have erectile dysfunction. Low testosterone, that is low male hormone levels like testosterone, can cause erectile dysfunction. And there are also few surgical conditions which can cause erectile dysfunction. Those who are undergoing surgery for prostate cancer, like a radical prostatectomy procedure, or those who are undergoing any radiation related to few cancers can develop erectile dysfunction.
So doctor, what are the risk factors of erectile dysfunction?
So the risk factors of erectile dysfunction are smoking, alcohol abuse, any drug abuse, diabetes, hypertension, lack of physical activities, sedentary lifestyle, eating a lot of junk and unhealthy food. All these can lead to erectile dysfunction.
So what type of tests are done to diagnose erectile dysfunction, sir?
So basically, erectile dysfunction is diagnosed with a thorough history taking. So that means we discuss with the patient very clearly what is he going through, how is he developing erection, is he able to maintain the erection, and after that we examine the man and see whether any other abnormalities are there with related to his penis or anything related to his pelvic organs or any abnormalities seen. So this is how we usually assess and diagnose erectile dysfunction. Mostly it is clinical assessment and clinical diagnosis.
So the next question is erectile dysfunction easily curable?
Yes, erectile dysfunction is easily curable. Majority of them can be easily treated with medications. Few of them can do well with just the counseling. And if the medications and the counselings also fail, now we have latest injectables which can be injected into the penis or implants as well. So we will further discuss them in detail subsequently.
So the next question is, doctor, how to prevent erectile dysfunction?
So yeah, this is a very important question. So erectile dysfunction is mainly a lifestyle modification disease. So anything which changes your lifestyle, like having an active lifestyle, having doing exercise regularly, eating well, consuming a lot of fruits and vegetables, reducing the unhealthy and junk diet, exercising daily, avoiding alcohol, smoking, and drug abuse. These are the things which prevent erectile dysfunction. So if you take care of your penis well, the penis takes care of you well.
So the last question for the day is, doctor, what are the treatment options available to treat erectile dysfunction?
Yeah. So this is a very important question and everyone needs to know. So we have many medications for erectile dysfunction which can keep you maintain your self-confidence, which can help you able to perform well. So there are some medications, majority of them can be comfortably treated with medications alone and they would do quite well. Those who don't respond to these tablets or medications, there are injections which can be directly injected, self-injected into the penis. We will train the person, will train the man suffering from erectile dysfunction so that he himself can do this at his home comfortably and there won't be any major side effects with these. If they are unable to do this, then there is penile implant, which we prefer it as a last modality where we are going to implant cylinders into his penis for him to able to perform well during intercourse or sex. There are two types of penile implants. They are non-inflatable as well as inflatable. Non-inflatable are basically placing silicone cylinders inside the penis, and inflatable ones, you'll have a latex material inside the penis which can be inflated with the help of a pump where the fluid goes inside the cylinders and the penis will become erect. After the sexual activity, he can again deflate these cylinders and the penis would go back to his normal position and normal appearance. So this is cosmetically better accepted. So inflatable ones are better accepted cosmetically.
Well, thank you, doctor, for your valuable time and inputs. So with this, we conclude today's episode of Let's Talk Health. We'll be back with another interesting episode for the next week. Till then, be safe and thank you for joining with us.